Assalamu alaikum wa rahmatullahi wa barakatuhu. I'm going to try to speak to the audience and in the camera in front of us here. So we're going to get started shortly with this this very important conversation with Dr. Asim Padella. Sorry for being a little bit late this morning, or this afternoon, but inshallah we will get started. Just to give some background information on the Nagamia Institute of Islamic Medical Sciences, we are at the actual location in Rolling Meadows for those of us who are following us online, and we have a part of this building is dedicated to Islam and medicine, the rich history of medicine in Islam and contributions to it. And then the other part, which recently opened just 1 month ago, is the Quran Museum. So it's an exciting time for Chicagoans, Muslims in America. We just recently had a curator who came and visited our collection here, which has very old Qurans, and every book there is entirely handwritten. And so, inshallah, after this talk, please feel free to network and get to know one another. There's a very small group of people, so we should at least get to know one another's names and hopefully be in touch and share information. I heard there's some people from the clinic, a free clinic that's out here, so we definitely want to learn more about you. And different organizations are here today, so we'll get a chance to network hopefully after our talk. But before we begin the actual program, inshallah, we'll get started with some words from the Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. Okay. So we're very fortunate today to have one of our leading thought leaders with us. Dr. Padella is also part of the NIMS board. We will start with a little bit of a background. The topic today being Muslim in academic medicine, a moderated conversation in Islam, bioethics, and Muslim communities. Medicine and Sharia brings together experts from various fields. Okay. Dr. Padella is an internationally recognized thought and research leader, as well as a widely sought-after lecturer in the fields of Muslim community health research and intervention design and Islamic bioethics. Using Muslim Americans and Islam as a model, he studies how religion impacts patient health behavior and healthcare experience. It informs the professional identities and workplace experiences of clinicians and furnishes bioethical guidance to patients, providers, policymakers, and religious leaders. This knowledge, this knowledge, can you leave this? Okay. All right. Thank you.
You okay without it?
I'm okay without it. Okay. This knowledge is subsequently mobilized towards educational and policy interventions. Okay. Okay. Methodologically, Dr. Padel's expertise spans community-engaged research, religiously tailored and faith-based message design, educational interventions aimed at health behavior change, discourse analysis, and mixed methods research. His current projects span behaviors related to cancer screening, organ donation, end-of-life care, and the intersection of religion and science, and are funded by the John Templeton Foundation, the Health Research and Services Administration, the Greenwald Foundation, and the Patient-Centered Outcomes Research Institute. He has authored over 120 peer-reviewed journal articles and book chapters, 3 books, and serves in an editorial capacity for the Encyclopedia of Islamic Bio Ethics, American Journal of Bioethics, International Journal of Medicine, and the Journal of Medical Humanities, as well as the Journal of Islam and the Contemporary World. His work and expert commentary has been featured in the New York Times, USA Today, the Chicago Tribune, Washington Post, National Public Radio, the Chicago Sun-Times, and CNN. With all that being said, I will give a little bit intro of why I was very excited to have this conversation. It's because I've lived in the Chicagoland area. I've heard about him. We've talked at different times about different things. I think it's a very interesting path, and I think many in our community don't know that much about academic research, about the overall program of overall becoming a physician and staying in that sphere. So I think it'd be very insightful for all of us to learn a little bit more about what does that involve, and just more about you and how you came to this spot. Okay, so we will get started with our conversation, or however you want to do it. We have heard your bio and titles, but can you tell us in your own words who you are and how do you define and identify yourself?
Alhamdulillah, it's really a pleasure to be involved with the board for inviting me to come here. And it's really good after, I don't know, it's been pandemic, so maybe 2 years I haven't been in this building so much. It's really good to see how it's come together and to be with you all today. And alhamdulillah, so you asked me the question about how I identify myself. And so I think, when I'm giving my elevator speech, I say, so I'm a bioethicist, a clinician, and a health services researcher who's interested in the ways in which religious values intersect with healthcare delivery. That's my sort of elevator speech. But I think for a community audience like this, the way I would say is that I try to be a bridge builder between our tradition and what's out there, right? In contemporary medicine, obviously healthcare is where I work. And so for me, that's the way I would say it, that I'm trying to build bridges so that we can, as a Muslim community, engage with healthcare in a way that is, in line with our value systems, but also transform the way in which healthcare delivery is occurring, right? So that if we believe ourselves to have a tradition that has value in society, that has answers to problems, that we should be non-apologetic about thinking about how we can mine that tradition, renew all the history that we were talking about, right? Where we were at the forefront of these fields, and do so in a way that is conscientious and one that we feel ourselves being enriched by. That answers the question.
Okay. So just a little bit of background. So what made you decide to journey into medicine as a profession?
So, I am a Desi, so I am, my parents are first generation immigrants from Pakistan. And unfortunately, or fortunately, this I don't know how long this is going to keep on going on. My children have no idea that they want to be in medicine. I'm not pushing them, but there's always this notion that that we should be thinking about a valuable profession like medicine, right? And that you grew up with that, I'm sure. Many of us have grown up with that. There was a survey done, I think, in 1999 that showed amongst the Muslim community that there were like 4 or 5 professions that everybody wanted to go into. Dentistry, being a physician was one of them. So it's continuing on 20 plus years after. But to be honest and not glib about it, I would say my origin story is not necessarily medicine, right? So alhamdulillah, my parents were very religious. We were affiliated with many scholars in our family tree. There was a darulum that we were associated with, and so I spent time in seminary. The goal was to do whatever you can do in a good way. Alhamdulillah, I was academically sound, so I thought, okay, maybe I'll do something in science, right? And I actually chose biomedical engineering, so I had no interest in going to medicine. I thought medicine was just about memorization, and I liked solving problems. So for me, I was an engineer. I was a biomedical engineer. And I had a deal with my dad that if I took the MCAT practice exam and I got a certain amount of score, I would consider doing medicine. And so that's what it was. So I had a degree in Arabic because I was doing a double degree in Arabic and biomedical engineering. Undergrad, I took a practice MCAT. I scored pretty well, and so I fulfilled my deal. I said, okay, now I'll apply. In a sense, and I got into medical school, and the rest is sort of history. But to me, it was about solving problems, and even the research I do is about solving problems, right? So I haven't given up this idea that we need to think about solving problems. I do that as an ER doctor, I do that as a researcher, but it wasn't just, okay, I want to become a doctor and just serve the community in that sense.
Very cool. Thanks for that candor about how you went into medicine. Where did you grow up? Which part of the United States?
So I was in New York, I would say. I'm a New Yorker. Some people say I still have an accent from New York. I don't know, but I grew up in Long Island mostly, but our family moved a lot around. As I said, that my parents were immigrants, so nonetheless, I would say that most of my life, in the early phases, was in New York, in that region. My claim to fame was that, or I say often, that I was born in the Long Island Jewish Hospital. And so there was some notion of a religious sort of dynamic healthcare. And I'm trying to bring that forward, not the Jewish part, obviously.
Yeah. Okay, and then you had some time in Chicago, because I know you have a lot of people who know you in this area.
So the biography goes sort of this way, right? So I was in New York for most of my life, went to medical school, went to undergraduate in Rochester, New York, did a double degree, as I already shared with you, in classical Arabic and biomedical engineering. I spent some time in Egypt studying abroad, Arabic and Islamic studies. I spent time in a Dar al-Uloom when I was in New York. And then after that, went to med school in Cornell, which is in New York City itself. New York, at that time, I went to medical school. Cornell just opened a campus in Doha. So alhamdulillah, I was able to be the first student to go to Doha and spend some time there as a researcher. And then I came back, back to Rochester and did residency, moved to Michigan. So you see all this is all prior to Chicago. I went to Michigan, University of Michigan, spent some time there as a Robert Johnson Clinical Scholar, got a master's degree, and then I came to Chicago. So Chicago is just maybe 25% of my life, most of it is in the other side. So alhamdulillah, I was here for 9 years, as you all know, at the University of Chicago. Worked myself up the ranks, assistant to professor, and then I left just 2 years ago.
Now you're in Milwaukee?
Now I'm in Milwaukee.
Okay.
Which is not, contrary to your belief, which is not a suburb of Chicago.
That's a compliment to Milwaukee to call it a suburb.
I don't know about that.
I think so. That's pretty much our championship. The Bucks championship. Joking. Okay. So yeah, whoever I reached out to in different places, they're like, oh, I heard him here in random parts of the state. So definitely had an eclectic experience being around the country. So when and how did you decide about academic medicine?
Yeah, that's a very interesting question. So I told you already that I wasn't necessarily intrinsically drawn to medicine as a field. In many ways, I think, as an advice to those in this room, you all know this, but if you harp on a certain profession, and I have 4 children, right, then they'll want to do the exact opposite of that profession, right? So I wasn't necessarily drawn to medicine, as I told you, but I felt that there was 2 things that happened, well, lead into academic medicine in a second. I was an EMT in a grad, and I really enjoyed being able to take care of patients, immediately be valued to someone, right? Again, trying to be a detective and figure out what's happening. So academics was something that why I say that is because I was going into residency thinking I'm going to be an emergency medicine physician. I'm going to work my shifts. I'm going to be off. I want to do some Islamic studies. If I want to, after, I'm going to spend time with them, right? So that was the only idea I had. And alhamdulillah, we knew that as working as an ER doctor, you'd be of value, but you don't have a pager. You're not tied to the hospital after you leave. And so what happened was that as many residents, I don't know who's listening in the audience, but as many residents know that you're required to do a research project or a scholarly project as part of residency. And I was thinking about what to do, and I did a little project on immigrant Muslim physicians and the challenges that they face. So I did a qualitative research project because I didn't want to stick something that was not valuable, right? So for me, it's like, well, this will help me understand how Muslim physicians function in the academy. So I did an interview, I learned the methodology, I did some interviews, and I published that paper. And that was, I don't know, many years ago, but I found that there were significant challenges that Muslim physicians were facing in just being Muslim. Right? There was discrimination. There was this notion of I can't really practice how I want to practice. So why I say that was that then I found that there was problems in the Muslim physician sphere. I'm going to go back for a second in time. So I was a medical, and that helped me think about academics, but I just fulfilled my project. And then going backwards in time, you all should know that I was in medical school in Cornell in New York City on 9/11, taking care of patients that day. So in the middle of between first and second classes that we had that day, that's when the tower sort of went down. And that was a very poignant sort of time for me in my life that I think has influenced my trajectory to this day. So you imagine, first year medical student, I have some EMT training, we go to a class, come back, go to your coffee or whatever, and then you hear this sort of, this ruckus happening, we go into class and the entire deanery of the medical school comes to class and says, you all got to go home, call your parents, the World Trade Center, the first tower has gone down, right? They said World Trade Center because we had another 2 towers that we'll go down later on. So we go back to a friend's dorm, and so at that moment we see the second tower go down. And my initial thought was, being steeped at that time in sort of prayer, I was like, well, I'm gonna have to go to my room after pray. This is gonna be a calamity for mankind. So, and then at the same time, right, some students were like, well, maybe Madam, you're gonna have a lot of patients come to AED. Maybe we should go and help out in the ER. So I said, I'll go. So I went and prayed. I went to the ER, and as an EMT, they put us on teams. So there was myself as the person who put IVs and so on, a doctor. And
did you say Allahu Akbar in the ER?
I said Allahu Akbar. It was a very emotional time at that point. We were on the Upper East Side in Cornell, right? So downtown is where all this stuff was happening, or south of Houston, so as I say. So nonetheless, what ended up happening is that with 3 hours, saw 3 patients or 4 patients, people were being triaged up, and you would see sort of, because everybody had their TVs on, right? All the stuff happening. So I get out of the ER, I'm looking 3 hours, and the students will leave, that they don't need us, because it doesn't look like we're going to get patients coming up, is what they sort of said. And so I said, well, let's go down to Chelsea Pier where they're doing triage, and maybe I can help out there at a couple of the students who had EMT training. If you've heard the story, I apologize if you heard the story from me, but what ended up happening was that at that time, I went to get on an MTA bus, and the doors didn't open. Then I went to another stop and tried to get on the MTA bus, the doors didn't open for me. And at that time, I was wearing kufi and a beard, so that's how I was the entire time in undergrad. I had a longer beard. It didn't immediately hit me, but then I realized, okay, this is what's going to happen, right? And people are going to think that Muslims did this, or have thought, because I was in the ER, I didn't listen to the news. And then I heard there was an anthrax scare. So that moment was very demoralizing, so I couldn't go help out. That whole night was obviously difficult for the entire humanity. The next morning, we go to our first class, and it's a special town hall session. Again, the deans come out. How are you guys? How are you feeling? They're filling out the class, and I remember that many things are said, but what sticks with me is that someone had said, probably shouldn't have said that, but said, now you Americans know how Israeli feels every day when Muslims bomb your building. And I was a Muslim. There was like 2 of us in the class. I think 3 actually. So I got up, I left the room. And that afternoon, the dean who I'd interviewed with to get into medical school said, we found each other or something. And he said to me something that why I'm giving you this backstory is, of course, that happens in residency. So he said to me, look, Asim, you're going to have to figure out who you are in medicine. Know that a patient-doctor relationship is, he didn't use the word sacred, but he said something like that, it's sacred, that it's the meeting place of 2 worldviews. To be a good doctor, you have to know your patient's worldview and value systems. But for the patient also needs to recognize where you are to be able to have you provide them with the best of clinical care and understanding of how to navigate the issues of medicine. So you can use your identity as a way to bridge build between the Islamic world, right, and us, or you can decide not to do that because you're going to face struggles every day being a Muslim in medicine. And so he said that, and I told you, like, fast forward in med school, I can talk about all that later on. But now when I did a residency project, and what did I find? That all these Muslim doctors, right, were just struggling, hiding their religion, right, leaving the practice, leaving academics. And I was like, this is just, why isn't everybody looking at this stuff, right? Why aren't we advocating for ourselves? Why are we just, okay, I'm going to go make some money, be a community doctor, and not changing the structure that is imperiling our future? So my chair, I said, hey, look, she said, well, look, you're going to do this doctor stuff, but really people care about patient stuff. So I ended up writing a commentary on clinical competency in Muslim care and Muslim patient, something like that. She invested money in me to do another project about how Muslim patients are encountering ER care. About 10 grand, right? You wouldn't get that as a resident, but 10 grand from this student and a resident is amazing. And that, after I did those, I published like 3 things in my first 2 years as a resident. At that time, I said, I'm going to leave. I'm done with my thing. But she said, well, my chair said, and my advisor said, it seems like you have an aptitude in an area. It seems like you're driven to help your community. Why don't you think about doing academics? and focusing on your community. So he pushed me, my mentor, Manish Shah, who's now the chair at the University of Wisconsin-Madison, Emergency Medicine. He said, why don't you apply this program called the Robert Wood Johnson Clinical Scholars Program, which is basically gives you a master's, it's the best training that you can get in any research area, but you pick your project. You say what you want to work on. So it's not a cookie cutter mentor, you just decide what you want to do. But it's very hard to get into, and he had done it. So I applied. I said, I'm going to do Muslim health research. I had interviews at 4 campuses, UCLA, Yale, Michigan, and Penn. And I wrote, this is what I'm going to do. I'm going to do Muslim health research. No one's done it. No one's really doing this sort of stuff. And I had an interview at the Michigan, the chair of the Michigan program, whatever. He said to me, what's going to be the issue? I'm giving you a very long story to the answer. But he said, what do you think is going to be the biggest barrier for you to get into this program? You get 28 people around the country who they invest $500,000 in, right? And I said, the biggest barrier is going to be that someone reading my application is going to say I'm Muslim. We don't want to do Muslim health work. Why are we going to do this? Why are we going to fund that? So that's going to be the biggest barrier. Later on, I got accepted to the program a year before my residency ends, and then I said, this is Qadr Allah Shami, this is the Khara. And alhamdulillah, I got into the program. Later on, the advisory committee chair, when I see him at the first national meeting of that program, 2 years after my interviews, he said, I had to advocate very hard for you to get in. Because on my committee where people were saying, well, why should we focus on this area and this, because there's no one doing it, is what I said. But they said, yeah, but there's no value in it. Right? This community doesn't really, right? Think about the Hispanics and African Americans and so on. So they're much more priority community in this community, right? So if you have just this many slots to give someone a slot, why don't we focus on a more important, more significant population than this one, right? And so, nonetheless, the reality is that I did academics because Allah, in my mind, Allah SWT is opening doors, and I said, okay, if He opens the door, then I should walk through it, right? If I didn't get in that program, I would be an ER doctor working my 10 shifts, and maybe then doing other things.
SubhanAllah. Yes. And another reason I thought this was very good conversation for all of us to have is that I think there is a dearth of understanding what academic medicine involves. And there's a lot of questions that, people who come out of training, they have, like how much, what sphere they can go into and how much influence they'll have. Do you feel as though the academic space currently is a welcoming environment for Muslim research? Are we not applying? Number one. Number two, internally looking at our community, do you feel that there is a strong importance towards people who want to pursue this type of career?
So, the academic type that I am, right, is a person who's trying to focus on community health work, right, that's Muslim focused, and on Islamic Bio Ethics, as you've heard, which has its own issues in the academy. I think there are many Muslim academics who are doing great things in different areas that aren't focused on the community or not in this area. So I know they're physicians, I can name some of them, who are making impressive innovations in critical care and stroke delivery, right? They have their own academic shops and multi-millions of dollars funding from NIH group. Alhamdulillah, they do great work. And there are academics who are doing teaching, right? Who are in academics not for research because I want to teach the next generation. Again, I think there are there. The challenge when I was going through it, I think still exists today, that there was no pathway for me. And I think today there was no pathway for people who want to focus on Muslim health work. Where are you going to find that pathway? Who's going to be your mentor? I didn't have a mentor. Right? If you want to focus on Islamic Bio Ethics in the academy, okay, tell me where that sits. Right? No clinical ethics program, Chicago, whatever I was, says this is a core value that we're going to teach you religious bioethics. Or we want to focus on the religious bioethics, right? That's not what the field of bioethics is about. And so I think we go in with a naivete that there is a pathway for us, and for the next generation. And I would say the deficit is that the prior generation didn't create pathways, right? We benefit from the masajid that our parents created, right? They were focused on other things. We're talking about institution buildings. Now we're building institutions. But think about the fact that the ones who are the upper echelon of all these institutes that you're teaching at, right, who are training the next generation, you would barely find any Muslims there, right? who are focused on their identity. So you asked me, is it more conducive? I can share you with the research data, but I'll share that at the end. So if you tell me, I'll tell you at the end of this talk the data, the statistics from our second national survey of Muslim physicians about what they're facing in the academy. But I'll get to that later. But I don't want to give you all the statistics right now because you'll say you're just spitting off data points. But if you're interested, I'll share it. So that's my line, that we as a community, right, have not focused on areas of advocacy within the halls of where power and knowledge reside. And so we are consumers, not producers of knowledge. And that is not just in the States, it is global. We just consume knowledge and consume technology. We do not produce it, and producing it with a worldview that is Islamic is even rarer.
I think that's a powerful point, and I want us to chew on that for a second, because when we drive by University of Chicago, Northwestern, UIC, whatever institution, do we pause and think like this is where so much knowledge is being disseminated, and then also the changes we think about societally, politically, they come out from these institutions that publish papers. I know that there's a new generation that's kind of thinking, okay, we're not going to necessarily make the changes we need just posting on Facebook, right? That we need more Muslim mental health professionals or something. We have to back it up with some sort of data that, there's kids getting bullied and whatever health outcomes we're having, immigrant families having poor health outcomes, not having access to health care. So I think that's also a good point for us to think about being consumers, not getting our hands dirty in some of this type of research. So thanks for highlighting that. What kind of challenges have you faced, and can you share some of the stories on those challenges?
So at some point, inshallah, should I have the time and space, I'm going to kind of write a memoir at this young age of mine, because I can share with you so many vignettes of difficulties. Allah subhanahu wa ta'ala help us traverse. But even we talk about University of Chicago. I was recruited to University of Chicago. The first grand rounds I gave in July was on my Muslim health research work that I'm doing. The first question that's asked is by an emeritus professor: why should we focus on a population that is bombing us, that wants to kill us? Wow. That's the first question that's asked by an emeritus professor at the University of Chicago on my first month at the institution. Right? This is before all this. I mean, you're talking about Islamophobia now, but right? My first interview at NYU, I shouldn't say institutions' names. I was a medical student. How do you think? Sorry, the question was, how will you care for Jewish patients? Because remember what a kufi here. How can you care for Jewish patients, right? I mean, they'll be scared of you when you come to the clinic, right? We joke about it, but the fact is the cultural milieu that we grow up in, right? In some ways, I think my post 9/11, post whatever, now is potentially worse. But it wasn't that great before. So the only thing is, right, you have to have sincerity that Allah, you have to you pray tahajjud, you make istikhara, and you rely on Allah subhanahu wa ta'ala, right? Because we can have as many difficulties as we think we can have, but He's the one who opens pathways and doors. So the challenges is always that I'll say it in a more academic way. Muslims are not a strategic or priority population for anyone in the United States. They are not, right? And this is different in other countries, but we are not. Meaning we're not, even in Chicagoland, talk about Chicago Sharif, that's why I say, right, 500,000 Muslims around here. Tell me which hospital here is saying, oh, we need to cater to you and develop Muslim chaplaincy for you and develop, Muslim same gender clinics for you, right? I was on the board I was asked to write for a surgical center that came up right when the CON, certificate need, was not approved in 2013 for our surgical center in the western suburbs, right? Because they said we want to create some more Muslim cultural competency things and have prayer rooms and have same gender provision. It was rejected, right? And so my research was used to say, no, this is a disparity population, right? And so then, I'm not saying I was the one, but we did a lot of work and then it was passed. But they're not a priority population for the powers that be. One. Two, when Muslims, now forget about Muslims, when Islam is looked at, it is either with a lens of an exotic sort of interesting dynamic, right? That they're exoticized, right? Or they're demonized. Right? So Islam is either, and right, whatever you want to think about the clash of civilizations thesis or not, it is either a demonized religion that has problems, or it's exotic. Right? So it's of interest, but nothing that's sort of theoretically high-minded up there, but it's not going to be applied here. So I think, not for me, I think, but for us, if we don't recognize, again, the wider context of these sorts of things, we're going to continue to be marginalized. And then we as a community, then lament. Oh, why don't they care about us? Oh, how come we're not doing this, right? And we overlook. And I'll say one last thing, because this group here is, I think, very well off. You might be able to traverse those things. I was able to traverse those things, right? I'm privileged, right? But think about that part of the community that's not privileged, right? Who has an accent, right? Who's an immigrant or refugee. We can say we're going to live in the suburbs and we're going to take care of our own and we're going to do all this stuff, right? And I'm going to get my children to go to Harvard because I can afford it. But those don't have a chance. No chance. And so, unless we own our own, I think that we can continue to say, please include us in your liberal ideas, right? Include us in this population, but we're not dominant.
Yeah, no, that's a good point. Even though these institutions kind of portray this, we're this ivory tower, we have these amazing principles, we care about every single demographic, we're non-judgmental, we're totally objective. There is we know there are certain populations they will look at with a certain lens. My brother, not too long ago, interviewed for graduate school, and they asked him, he's not Afghani, he's an Indian Muslim, they asked him, how would you deal with women? Because the way women are treated in Afghanistan is horrible. He wasn't prepared for that. And, even if somebody asked me that on a cold day, or just a regular day, they might, get a piece of my mind, or I'm going to say astaghfirullah. It's a very tough situation to walk into, especially in your scenarios, from what they asked you. So these things do exist still. So you work obviously on Islamic Bio Ethics. Help us understand what that is and why is it relevant to our community.
So Islamic bioethics and the sort of I'll tell you what it's not, and I'll tell you what it is. So Islamic bioethics is how I define it in this book, whatever, is as a discourse, right? It's a dialogue between our tradition, the moral tradition of Islam, and contemporary healthcare. And that dialogue often involves two individuals, one representing the Muslim tradition, Islamic tradition, and one representing, healthcare or contemporary biomedicine. Oftentimes, we all reduce that down to some mufti answering a question. That's what it is not fully, right? Because there are others involved in a discourse that brings out the tradition or values of the tradition to apply them to healthcare, right? Be it health policy or practices or even just issues at the bedside. So it's not only reduced down to a mufti and a medic having a conversation, although that is one modality of Islamic bioethics. It's a growing field in the sense that it's an area that is, when you break it down the terms, what's the Islamic that we're trying to apply to bioethics? And what is the bioethics that we're trying to create, right? So there's many views, and an academic, I'm gonna end in a second, so I don't want to make our eyes roll back and say, oh, he's talking academic speak. But what is Islamic that you're going to apply? Is it Quran and Sunnah? Is it things that aren't against Quran and Sunnah? Is it what Muslims did in the past, right? What is the Islamic value system and how are you drawing upon that? How are we using the texts is a debate, and you have to think about that before you label something Islamic, right? Like Islamic mortgages. Well, what does that mean? On the other side, bioethics is an academic discourse and field. So, well, like I said to you, right? So where are we? Bioethics has degrees, has fellowships, has centaurs, right? Has journals. Okay, so we can say we have Islamic bioethics, but to have a field, you need to have all those infrastructures there, and there isn't a single one globally that is a center for Islamic bioethics. And the bioethics centers that exist are predominantly ones that focus on public reason-based arguments that are secular, not religious. The religious ones that exist, there's Catholic Center for Bioethics, are ensconced within institutions that have religious values, and they bring it forth. So the field somewhat, that's what it is. The discourse, but I'm sort of telling you that even that debate, which register of bioethics, how we engage with ethics, it's not just simply patient level things, right? Your recent decision about Roe v. Well, not your decision, ours and Dobbs, right, whatever, Roe v. Wade, that's a bioethical conversation. There were presidential commissions of bioethics, right? It's a societal level issue. So in any case, my point is that that's not a mufti talking to a patient or a doctor. That's another discourse.
So, just some food for thought, like, this Roe v. Wade. We don't need to go into the details of it, or what your perspective is, but just in terms of the average lay Muslim looking at this, right? We got Yasser Qadhi videos coming out, this is what we think, Umar Suleiman, everyone's got their own thing, and then there's another group of people, like, where our personal freedom, personal choice, civil liberties, that framework. In terms of that perspective, what do you think the average Muslim should have or reach out to?
So I think there's two things. One, I think that Muslims should know Muslims, generally speaking, it's fardu ayn upon you to understand the ways in which your actions are judged by Islam, by the Islamic law, right? So and this is not me saying, this is fardu ayn. You're going to go buy a house, you have to know the ways in which that is made halal and not halal. If you're going to have a child, you need to know the rituals around that, right? The mustahabat and also the fara'id. If you're going to you're going to get married, right? You're going to be a doctor, same thing. Why do we divorce them? You're going to be a doctor, then you need to know the boundaries within Islamic law that you can practice. But many of us go into that field not thinking about that, right? And then we have these questions. Okay, well, what are the Islamic guidelines on abortion? Can some book tell me? Right? Because we haven't devoted ourselves. If we're going to go into a practice and want to be Muslim within that practice, or we're going to engage in an action, we should learn before. Right? You have premarital counseling, right? So it's first of all you have to spend some time and I'm not going to. I can tell you, but I'm not going to tell you right now. There are boundaries, positions within how Muslims should engage with the act of abortion at a personal level. Okay, all right. Now, the other issue is how should Muslims engage with society that is pluralistic and has ethical pluralism there, and it's not just a Muslim society. How do we engage with the legal and policy dimensions of abortion? Right? What preparation have we done to that? So people can start quoting, this is what the Sharia says, this is what Islam. Okay, now if we're going to take that Islamic ruling and apply it to a policy, how would that look? What would that look like? We have contemporary and sort of classical examples. So I ask you, what's the abortion law in Malaysia? Malaysia is a country that's minority Muslim. It has a majority Muslim, but it has a lot of different minorities there. They engage with the question of abortion. How do they do it? Right? What are their ways of thinking about finding a mean between the Islamic value system and what civil society would tolerate? Right? If we believe as Muslims, again, I started the talk this way, that our tradition is universal in the sense that Allah subhanahu wa ta'ala has given this faith. This faith's value system is applicable across time to all people, and we want to see our society bend towards the arc of what Islam would say, then we need to learn what Islam says and think about that. It is not a question of restriction of personal liberty and so on and so forth. That viewpoint, I would ask you, well, where does Islam come in? Right? And you've seen me probably on the Twitter storms at times. If we're going to have candidates coming and saying, I want to go be, an legislator in the state government, what is Islam? What is your notion of Islam tell you how to participate in a process that has a pluralistic outcome? What is the Islam that you're bringing beyond your name and face and your beard? What training do you have to think about, right, where religion comes in, where you're actually responsible and liable to Allah subhanahu wa ta'ala for fulfilling the values? If He gives you authority, then you now have a responsibility on the day of judgment of thinking about, how am I meeting out that responsibility because I'm in charge of all these people? And when I'm signing a bill, same thing. When I'm commentating on Twitter, maybe not, right? But still, you're responsible for what you're saying. So I think the question for us all is, if we think that Islam, right, that Allah subhanahu wa ta'ala, forget about Islam, this is harder, that Allah subhanahu wa ta'ala would want a society that is permissive of abortion, or not. Or a society that has, where abortion is the norm and not the exception, or not. And if we can resolve that, right, however, then we can start participating in the conversation. But many of us have not resolved that. And then we shouldn't be participating in the conversation. I don't know. So that's...
No, that's a great response, and I think I'm going to do some homework on what's going on in Turkey and Malaysia in terms of their Sharia boards. We're going to go with 1.5 questions, and then we're going to open it up to the audience. So, and online, if you have any questions come through, we'll see them pop up here. So we know you work on Muslim health issues. Help us understand what that is. Why is it important? And then some current projects you're working on.
So the Muslim health work I do is really focused on how our beliefs, Muslim beliefs, values, and the identity of being a Muslim influence healthcare disparities, right? Health inequities. That's basically. So for me, it wasn't drawn out of topics. It was drawn out of, okay, where is there an issue where Muslim identity or Muslim beliefs or values are now intersecting in a way that's causing disparities in our community, right? So the groundwork that we did here for a long time with, mashallah, collaboration, some of the people here in the room were collaborators on some of the work, focused on those topics. So for example, breast cancer was a 6-year project. We found, right, that Muslim women, despite their socioeconomic status and their ethnicity, were less likely to get adhere to mammography screening in our community, even at our big masjids that are well-to-do, right? We found that there's issues in organ donation, which obviously an Islamic now notion of what is permissible and not permissible was a gap in knowledge, which created some problems of people engaging with organ donation in a way that's concordant with their values and their life care. So I'm working right now on a project with a Muslim Community Health Center in Milwaukee, where it's called, where we are developing a Muslim home hospice system. First, thinking about what the problem and gaps are in palliative and hospice care, then to create their own system where they're going to create a multidisciplinary team that will provide support to home hospices, right? For a home hospice program that's authentically addressing Muslim needs. So first, we know what they are, but then has an Islamic vision, moral vision behind it. So in my Muslim community health work, I've been going where there's a problem, where I can get funded, really, right? Where some funder will find this work valuable. So that's kind of the area. Why is it important, you asked? Because no one's going to study our problems except for ourselves. I just told you there's no prior biology. No one's coming out here to do work for us. And I will tell you the biggest challenge has been on that sector is that we ourselves don't participate. We have no one to blame. So in my community health work, right, we spent, I'll give you an example, statistics now, and then I'll end with my statistics. So, and some people are here. In our community breast cancer project, 13 massages signed up to be part of that, right? We spent 5 years investing from our side of our community $600,000 to figure out what the problem is, create a curriculum, and then implement it, right? Obviously, I'm a male. I'm not going to go implement it. I had colleagues who did that, right? From 13 masjids, it came down to two who participated, right? From the initial 254 people, 50, right? Despite the fact you're getting money to come, to show up, you're getting money for the site hosting, despite the fact you spent time to sponsor to develop the program. So now I go back to a funder after 6 years. So you gave me $600,000 and I got you 50 people. You think they want to fund us again? Right? We did the program, built it. The only one that's research tested efficacy in improving mammography rates among Muslim women. Okay, I did the research. Now you all take it and do it. Where's it being implemented? Nowhere. It sits on the shelf, right? And I think, okay, so you didn't design it, but we got it designed. I'm not saying us as a community. Now we're not, even the knowledge that exists, we're not implementing it further, right? And so those things are going to be a problem for us, even if we get that thing, if we don't ourselves own it. Muslim physician studies, 10% participation rate, despite getting money to show up. So we ourselves don't show up to the game. We got no one to blame, right? And that's why it's important. So unless we want to jump to solutions, doctors want to jump to solutions, community members want to focus on solutions, well, first figure out what the problem is. If you misunderstand the problem, your solution won't work. And that's why the edifice of scholarly research exists, to better understand the problem. And same thing with fatwas. If you misunderstand the problem space, your fatwa will be inapplicable as a solution. Okay. Yeah. Okay. All right.
Okay. Just also one more thing. I don't know if you want to talk about the Medicine and Sharia book that just dropped this year. If you want to talk about that a little bit.
So this is
also here for a book signing today. Available.
Alhamdulillah, this alhamdulillah grows out of some of the work that we're doing. I was in Chicago, and it's an edited volume that includes ulama. So I said in Bridgeville, right? So you'll see in this book some of the chapters are by ulama, some are by social scientists, some are by physicians, and there's 4 of the chapters of mine. We're trying to initiate a discourse around how the intersection of medicine and Sharia, right? How do we think about this in a way that's multi-tiered, multi-dimensional, and nuanced? And for those, so this is one, alhamdulillah, there's a story behind this too. So if you give me a second. So this book, I tried to get this book published by an academic publisher for about 4 years, okay? And you know why they didn't publish? So first of all, as an academic, you should publish in a university press. All right, so I had the presses written, I did all this stuff, and then I was trying to get published by top 20 presses. And I was getting rejected. Part of it is an edited volume. But then one editor said, let's just chat on the side. Because he had 2 books that are edited volumes in Islamic Bio Ethics in his collection. I said, why not do a third? Well, go as a package. You can have package deals. And he said to me, this is also business, right? There's no value proposition in my doing a book like this. I said, why? Because the moment those other books come out, they're PDF'd and Photoshopped and put everywhere around the world, no one buys it. And so you'll say, well, how much is this book? This book is $75. Why? Because this press said, well, we're going to have to sell it this much because we know people are going to just spread it around Twitter and wherever else it is, and no one's going to buy it. Right? So he said to me, well, it's a nice topic, but I did 2 of these. And again, who's to blame? Who's to blame? Right? So I'm just telling you, there's so much stuff that happens, right? Yeah. But this one, alhamdulillah, we have a good publisher, alhamdulillah, and inshallah, there's another book that 2 other books that will come out soon, inshallah ta'ala, but alhamdulillah, there's been good response from the community. I hope it's valuable. It's not a fiqh of medicine book. It's a book about discourse. So.
Did you say it's published?
No, it's University of Notre Dame. University of Notre Dame. For them?
Yeah, so maybe the online audience can hear.
Sure.
We're going to go to the question and answer session so our online viewers can...
problem that you raised. Every board of education basically defined as problem-solving ability for education, whether that's medicine, engineering, or whatever, personal life. So, no matter which discipline that you come from, that's what it leads to. The thing that I was asking you about was the huge conference that you conducted in downtown Chicago a few years ago, where Christians, Jews, and Muslims from Europe organized a huge meeting. And I did attend that meeting. A lot of discussions went through. At that time, these problems that you're talking about, as they came up, whether there's abortion or
whether there's
abortion, ethical issues.
Yes, so the conference I think you're referring to is the conference that I was recruited to University of Chicago, and I was part of the program of medicine and religion, which was between the divinity school, the ethics center, and the medical school. So I was part of initially a triumvirate of leadership there, and then alhamdulillah, the other people got endowed chairs, they left, and I was left to me. But we started a conference on medicine and religion, which alhamdulillah now has like 300 people come. It rotates around centers. Last year, this next year is going to be in Ohio State. Last year it was in Portland, I believe. I've become a little disassociated from that because I left Chicago and I'm not part of the program anymore. But what I want to say to your point is that that conference was an area where religious communities can come together and speak faithfully. So there were issues around how Catholics view abortion. There would be talks like this. Yeah, but there would also be what was, I think, very enriching for me was to see a healthy, nuanced critique of modern medicine from religious communities, right? And again, Muslims were few and far in between who would come to that conference. but they were really thinking about whether their ethical vision, their moral vision, their theological vision is being applied to medicine or not, right? I'll give you, you're in Chicago, go visit Lawndale. The Lawndale community, the healthcare system, is coming out of an evangelical Christian notion. The way they deal with certain things is all aligned, right? Go visit Loyola. My friend was the vice president of mission and identity at Loyola. The way they think about healthcare comes out of a religious paradigm. 40% of health in the United States comes through Catholic institutions. You know, but it's fully baked, right? And what we have, again, is just accept me as a technician, not as one who's formulating the healthcare delivery models, the moral vision, the philosophy of care, the paradigms in which we operate. So that conference was about that. So alhamdulillah, I think it's an amazing group of individuals that will put that on. And inshallah I'll be able to hopefully participate in the years coming. I have my mentees go and present there when they can, because I think it enriches their own understanding. How to be faithful, but yet be critical and be a part of a movement.
Physician as such has a very limited role in changing the
microphone.
Medicine, the physician as such has a very limited role to solve the big problems we talk about. We need to be in politics, we need to be in the legal system, and many other areas of discipline where we become the voting population, the electing population, to bring about a change. So I think that you can only do research and publish. I don't think you can bring about behavioral change that we talked about. Only.
I mean, everybody, right? You all have a zone of authority, right? You open your own clinic on wherever, right? In the suburbs. You can decide how that clinic operates, right? You can decide what things it participates in. If you say, it's from the simple, if you say, I'm going to provide people free care, you can say that and figure out how you're doing it. If you say, I'm going to not engage in certain practices that I believe they're antithetical to the Muslim tradition, you can say, I'm not going to provide those certain practices, right? This country treats medicine as a free market economy, right? And this is how Christian, if you can get people to pay for your services, you can do almost anything you want, license-wise. Similarly, if you can stay solvent and say, I don't want to participate in these things, you can stay solvent, right? I mean, you can. So you can say, no, I'm going to not do certain things. I'm going to participate in certain things, and alhamdulillah, you can do that. I mean, I think, so the power is where you're at. If we're a lot of community doctors, we could have associations, right, that forward that vision of here's how we want to met out healthcare. We don't do that. We are consumerists of that model, right? And there are a few places, I'll tell you, that try to do that, but in a whole scale we haven't. So that's my thing. And now I will say the other thing. You know, I was in what position of power, right? I was in a position of power to be able to say that I want to practice my own faith. I don't want to work, I don't want to do these sorts of things, right? I want to participate in certain types of things while I'm a resident. I don't want to participate in certain types of things when I'm a faculty member. And again, within the bounds of the academy, okay, well, if we can support that, okay, then you don't have to do that. You can have your Jummah off. You can not go and do your training in an abortion clinic. You can have a simulated model, so on and so forth, right? They are accommodating when you put your own foot. No, I need to be accommodated here. We don't do that. We keep ourselves as a lower hand. And there's many good reasons for that. We're immigrants. We feel not going to get a spot. But that mentality of the parental generation has led to, I would say, a younger generation that is divorced from how they should be engaging with medicine. Right? What worked when it's a necessity is not the normative that should be used forever. And I think that's the challenge. So I'll give you a data point. I'm going to stop. So our big study, national study that we just did finish last year, 2021, we have a big webinar, inshallah ta'ala, in October before the election. Every marker of discrimination we did our first national survey of Muslim physicians in 2013. We did a repeat one in 2021, looking at discrimination across career, discrimination by patients, discrimination, right, that you perceive discrimination by patients. Every marker increased. So 9% patient discrimination, now 33%, right? Discrimination over career, over 50% of the sample of 263 or 64 Muslim physicians said they've experienced discrimination in their career. Currently experiencing discrimination this time, almost 40% at their current workplace. Leaving your job because of discrimination, more. Every marker. We also did the health markers. 50% were depressed. 50% experiencing burnout at this time. Whose problem is that? I mean, do you think they're going to care outside? And so we're pushing our children into a profession that is now harmful to their health because we didn't change the structure in which they practice. Right? Better yet, the qualitative interview showed declination. The interview showed declination of religiosity. People would go into training thinking they could pray, they could wear their hijab, they would leave training without both of those things. Now you tell me, you want to be Muslim in medicine?
Those are good points. Any questions on the sister side?
When it comes to I know that you're in some tough times. I don't know how did you pay your debt, for instance, for school. I mean, my son is young, we're not talking about the young doctors, so
She just wanted to be on the mic. Just for me, not for the online audience.
But the way when you talk to him is the debt.
The debt.
The amount of debt that he has to pay back to the school, over $400,000 in order to, if you're talking about him getting married, him getting, I mean, because I'm 34 years old, and he is, does his kids, he does his home, and we talk to him, say, I have to pay my debt.
Yep.
I have bills. So when we talk about freedom also, something that we have to be included. We don't have Muslim society that can provide to really build doctors that can really have the freedom to serve the way they want to serve.
Yep.
This is something is major. Not everybody has the privilege to, even not like you said, the parents who can pay for their kids. And even if they pay for their kids, that's undergrad, they cannot pay medical school.
Yeah.
So when talking about this issue, it's not as easy.
No, none of it is easy. And you raised a good point, right? You raised a important point. So we're talking about reforming the system. How come we have not been involved in that? So, right? So, alhamdulillah, now I think Imana has some scholarships for Muslim students, right? But, compared to the need, it's probably very small. I, alhamdulillah, may Allah bless Dr. Fadl's family, but I got some money from them. I got some money from my family. I got some, I told you, we're first generation. We weren't very good to do. I got some scholarships. I didn't pay a dime. I paid money. I had no loans when I left medical school. Right? But I'm not telling you to be poor so you can get a scholarship, right? But my point to you is the opposite, because I resolved for myself that it wasn't necessary for me to be a doctor. So I would not take a loan because daruratan, there's no darura here. I can be an engineer. I can make my $60,000 being an engineer. Alhamdulillah. Yeah. And so I was not going to go to medical school if I had to take out a loan, because I didn't believe it was. If I didn't believe, you can say whatever Mufti says. I didn't believe it was halal for me to do so.
I mean, your story is so rings home to me, and I'm sure a lot of people. I think it has to be a part of the conversation. So I'm just going to repeat it. The sister is saying her son is a. Can I say it? Okay, her son is an ER doc, and he has quite a bit of student loans, and so he's 33, 34. 34, he can't see his wife and kids. He's trying to pay it off. May Allah make it easy for him. I say that sincerely. Ameen, Ya Rabbil Alameen. We don't have any institutions that do student loans. There's a continuous charity that's trying to come out with that. And me, myself, I took $500,000 and I disappeared for 5-6 years because I didn't know how heavy this was until I got under it and it was too late. And, I have another, my wife, we all are in this circumstance. And, by the time you get out from it, it's hard to say, what am I supposed to do? The reason I'm bringing this up is not to feel like a victim. But the point is that when you get out of this, then people are like, okay, I got to move to Oak Brook or Naperville and get my Porsche, and then khalas, I'm out. He will be out, inshallah, one day. Inshallah, he will be out. Alhamdulillah. You know, God willing, he's healthy and he gets out. So it is stressful. We do need to have better community resources, community resource for halal financing. The pressure that can put on a household with two people with large student loans is crazy.
I'll also say again, us, right? So when I was an undergrad, I appealed the financial aid form. I said I cannot take out loans. They gave me a lot more work study. I worked 2 jobs, right? I applied to medical school. I said I can't afford to be medical school, period, right? I said I can go to state school. And the private medical school said, we'll match the state school because you're a great student and want you here, right? So I'm not saying they did. That's Allah subhanahu wa ta'ala, right? But you have to have the niyyah and you trust in Allah subhanahu wa ta'ala, and he opens doors. And if he closes that door, he's a hakim. He knows why. I don't. So, may Allah subhanahu wa ta'ala help us to find the path that he wants us to be on and be contented with it.
You have a question?
Yeah.
That we need that kind of education in school. When they do shadowing, for instance, in high school, they bring the profession, and the profession will come and they look up to him, oh, I want to be like him and I want to be like him. But really, they don't talk about the under, the negative side of, oh, you see a doctor, neurosurgeon, look at him, look at, So I feel like this is something, it's a must to be done in high school. Not only for medical school, but we have lawyers that have a huge, if you contact everybody, you don't have to be a lawyer, you don't have to be a doctor, you don't have to. Then what about Muslim profession? It's not, in my opinion, sorry, you disagree with me, but it's not, we have Sheikh Qaradawi, and a few years back, Sheikh Qaradawi was totally refusing people buy businesses almost. He said, I looked at Muslim, and I see always Muslims struggling to make their ends, and I feel bad. Long time ago I was saying no, but now I tell Muslims to go and do it and rise a little bit above and help others. So I believe, and this, we need a group of scholars, a group of professionals, a group of doers. You fulfill your dreams in the right way, and you give that idea about the whole aspects of profession. And then you tell them, I believe these are the resources. Work from now. You are for the first year high school. Work from now. Try to get these resources that you can get free education. Stuff like that is very important. And then we have to go to do our job.
Okay. We're gonna have to. Thank you. Okay. Sorry. All right. We have one more. We have. I know we met a little bit earlier. We have a transplant nephrologist here who had some questions as well. So.
Putting this event together. So, sorry to switch gears a little bit. My question is just your advice to physicians who are grappling with certain issues related to Islamic bio ethics that conflict with what the mainstream practices in certain areas. I think there are certain issues that it's kind of clear cut where the Islamic opinion is clearly conflict with what's happening in modern medicine. But I think there's other issues that there's a diversity of opinion even within the Islamic sphere. And specifically, I'll bring up, I read in 2020 published that paper in Transplantation about the Big Council of North America's position on organ donation. And it's something that I've been grappling with as a transplant doctor for many years. Like, what's the Islamic opinion on brain death? Like almost 2/3 of deceased donor transplant come from patients who are brain dead. And if Islamically that's not considered death, then you may be murdering these people to take their organ, which is a really heavy thing. So what's your advice for Muslim physicians, where there is a diversity of opinion, like the OIC says that brain death is considered death, whereas the Big Council of North America didn't have that opinion. How do Muslim physicians grapple with that and not just choose whatever opinion is convenient for their practice?
We'll make things easy for us and give us clarity, right? So haram bayyin wa halal bayyin, right? So I think that your struggle is actually the quintessential struggle that we should have as a Muslim physician. That one should be concerned about what they're doing, whether it aligns with what divine pleasure or not. And that you're having this question already shows that you're struggling with that. And many of us are not believers. Allah has given you this blessing to be able to struggle with that. So that's the first thing I'll sort of say, right? To think about it. Because many are blind to this and ignorant, but ignorance is not necessarily what's the word? Ignorance is not an excuse. Yeah. So now to the question of diversity. Let me share with you at a practical level, and then sort of more at a more personal level. So at a practical level, our teacher, Sheikh Amin, was here. I remember he gave this. We had this wonderful, in collaboration with Darul Qasim, University of Michigan, the conference in 2011 on Islamic Bio Ethics. And we had a round table at the end for all select 50 people. We had to provide an essay to get into this round table with some of the premiers. Or the Sheikh Amin was there, but there was others, professors, whatever else. And we talked about brain death because it's been something I've been doing for a long time. And withdrawal life support. But he made a statement, and I'm going to the extent, so I'm going to paraphrase it, that why I'm repeating it is because later on a physician came to me and said, I was so disturbed by this conference, right? Because you were talking about all these sorts of things and all the debates but that one statement by Sheikh Amin, was like hit my heart. And now I can leave with some positivity. He wasn't upset with the conference. He just was heavy stuff we're talking about. And he said, so Sheikh Amin sort of said, where there's ikhtilaf, there's a hadith and to the Rasi ikhtilaf, that the ikhtilaf is a mercy upon my community. But he said, where there is difference of opinion, no, we do not either know there is sin there fully. There is no sin there. We cannot tell you there's sin there. And so if that's the case, right, recognize, be unburdened from this notion that there is definitely sin here. Because that person was struggling with, am I sinning? Like you said, right? I don't remember the quote, but he said, am I going to be asked on the day of judgment, right, because I did this or did that? And his response, Sheikh Amin's response was something like that, right? That, look, we can't say that. This is why we're having this debate here today. We don't know. So relieve yourself of that notion that there is definitely sin here. If there was, we would all agree at this table. So I think that was a beautiful, may Allah bless him and increase him, a beautiful statement that he made. So that's the sort of the practical. Now the personal is, okay, so now Allah has called upon you to make your istikhara and decide where your heart resides and ask Him, be connected to Him, where His divine pleasure is. You cannot outsource that to the mufti anymore. Because if there's ikhtilaf, that means you have to learn where the ikhtilaf is. Why is there ikhtilaf? And then you make your istikhara and you say, Allah, guide me to the path that is felicitous for me. Right? It's not an abdication because there's ikhtilaf, which may teach. It's actually a call to now do your duty. You're the one who has taklif. And many of us treat the ikhtilaf as, okay, it's ikhtilaf, I'm going to do whatever I want. That's the opposite. Now you make your own, not ijtihad, but you do your juhd to figure out what the issue is. And then solve your resolve your issue. Now, I'll say, last thing, because I think you have a follow-up, that the fact that there is disquiet within your heart, right? Leave that which gives you, makes your heart tremble and not peace, to that which, that's a hadith, to which gives you peace. Right? Tells you something about your fitra and what's happening there. And our empirical data tells us there's a problem there, right? So maybe that's not what the system's supposed to be like. Right? And maybe you claim conscience then, which is why conscience claims exist. Because my conscience cannot resolve this as something that I should participate in.
There's two aspects to kind of what you said. There's two aspects to what you said that I just want to follow up on. So, the aspect about making is the thought and seeing where your heart is feels more at peace with, which position you feel like Allah subhanahu wa ta'ala with. The other I completely agree with that. The other position that I kind of have a little bit of trouble with is like, do you feel like as physicians that are not trained in Islamic jurisprudence or fiqh or anything like that, sometimes I feel like I'm not qualified to go in and dissect the arguments that led to that opinion by each of these fiqh councils. And if I'm, so how do I reconcile that? I don't have the training to actually do that.
Yeah, so my response is, this is why the Initiative of Islamic Medicine existed, and we do bioethics workshops in Muslim communities, not just for physicians, but for individuals who are facing an issue, to give you a sense of what the surface level conversation is, so you know the rationale behind the ikhtilaf, then you can make your own, right, informed choice around it. I mean, that's what we were doing workshops in Muslim communities for, is to digest all of that, to give you a simpleton's view, but not simple view, of what the debate is, right? So that you can then make an informed decision. Because as I said, when there's ikhtilaf, I believe there's a call upon you to now figure out, not to just say, okay, well then whatever I do, I will go in my life and just do whatever I do, right? Because then I think the hawa comes in.
Just one question. Hold on. Is there any more questions from the sister side? Any comments?
You want to
or
end with the
questions?
sister's question?
Yeah. Any questions?
No.
Was there any? Just one. Did you still have a question? Your hand was up. Minaj, you want to go ahead?
This is the last one?
Yeah, this was the last one, then a comment, then
There's
we'll
nothing
close.
here.
Yeah, no.
The question is it better, this is mostly your opinion, is it better to integrate in already established institutions, bioethics, versus having our own institution, i.e. having a chaplain in a hospital that's already up and running in Chicago, whatever, versus having a Muslim hospital? Like how do you have like a Jewish chaplain in a hospital versus a Jewish nursing home? We take our own institution, we make them own. It's really tough to go with something so rudimentary versus something so.
Yeah, I think it. So from my own personal perspective, I think it depends on kind of what sector you're talking about, right? Because there's certain things that others can't do for you. So let me take your example. So you said about Muslim nursing homes or something, right? I think you said that, right? Do I really think if I teach an individual the cultural notions and religious understandings to care for patients, is that valuable? Yes. Do I think that Muslims who see this as and are serving the Muslim community with ihsan and see this as a calling from Allah subhanahu wa ta'ala, right, are going to be able to do something more and treat with some more level of love and care than a non-Muslim? Potentially. Right? I'm not saying that a non-Muslim can't do that. But those who are trained, like, I mean, I'm going to give a talk in 3 days about Iyadat al-Marid, right? About, I mean, you're literally visiting, in a sense, right, a patient who is at a level so close to Allah subhanahu wa ta'ala that the dua is accepted, right? That Allah tells you that if you didn't visit me on the day of judgment, you would have found me with him or her. I mean, what maqam is that? Huh? And so someone going in with that mindset, I think, would be phenomenally different than one who doesn't. So in those areas, I think we recognize that there's disparate care in those areas. We don't have solutions, and we come up with ours. And there's no reason. It's actually a mark against our Muslim community in Chicago now that you don't have one. You got so many doctors here, man. What are you talking about? You have so many visiting nurses services, but tell me, right? Do you have facilities where my loved one could spend as a rehab after they had broke their hip or whatever else, right? Or someone's passing away on hospice care, we don't have one. The other bit is that when you're talking about changing discourse, so chaplaincy is a discourse, right? It's not just, we have engaged as a Muslim community, there's many Muslim chaplaincy institutions here. One of them is a sponsor of this talk tonight by Adam College. You're engaging with a field that is not original to us, so to speak, right? But there is a notion of how to reform chaplaincy so that it is, not reform, but renew and revise chaplaincy and make it our own. I think you can only do that when you engage with that system, right? You can't do that outside, meaning if you can create a chaplaincy system, but unless you understand the particularities of what chaplaincy is in the United States, you're not prepared to create your own model of chaplaincy, is what I'm saying, right? And as far as a Muslim hospital, last comment. I don't know, just like I don't know what would make Islamic Bio Ethics Islamic, I don't know what makes a Muslim hospital Muslim. I think those who engage in that, I've done surveys that show that people want a Muslim hospital in the country. That if we're going to do that, then we should do it in a way that is fully baked. From the way we engage in contracts, to the way we deliver care, to the way that we train people, to everything else, right? And there are some that are not in this country that I know, like the Muslim-friendly hospitals, the Ibadah, worship-friendly hospitals in Malaysia. They're focused on worship, right? Helping people worship when they're in a state of illness. There are others in South Africa that focus on community-based care delivery models, right? Now we could create a vision for healthcare by an exemplar institution. But if we're just saying the Muslimness is because of some other reason, because Muslims work there, and this vision is not carried forth of all of it, then I think we're doing a disservice in a way to what the potential could be for us to transform the way care delivery is provided in the United States. I think we're out of time.
I just had a last question.
One last question.
You can't.
Can't. He's
Sister raised a question about education in the Muslim kids and scholarship. This particular college, Muslim college, and we trained many kids from the college. They came from Somali kids from Minneapolis, and we give them pre-med education and send them to foreign medical schools. But what is the trend is really the community has to critically think and explore. If you're building a mosque, all Muslims get together and raise funds, and they have a mosque planning. Nobody thinks that it's halal or it is halal or it is to give it to a college or a school. This is a mindset of Muslims. So I've been working with the Muslim communities in 1967 in this country. One of the founders of Islamic Bio Ethics in North America, this International School of Islamic Medicine, was charged as one of the charges, see if you can build a Muslim hospital and a Muslim medical school. So this college will be, I'm the corporate chairman of this college. When we applied for the DO school, we were approved for the DO school. It required $80 to $100 million. There were no takers. All the universities, Allah bless them, all the Jewish brothers took over the majority of this DO school that opened up. So we have a fundamental problem with Muslims. So individuals like you or I myself, basically they paid me to go to medical school. I went to medical school free. Other examples are less. I was paid like a physician's salary in my scholarship, but they're exceptional. But the whole problem is community as such is not. It's one part. The second part, other question I wanted to tell you that we have a Muslim head of Department of Cardiology at Rush, Muslim CEO at Rush, Muslim chief of cardiology here at the USC is right here, now the bar, and a fellow Naman is in. So many of them have come up in Islam. I don't know whether they can do anything, whether they can influence anything. Maybe what kind of problems you face to become the chief of cardiology at USC. Maybe you want to comment on whether they can do anything?
I have to be honest, I didn't find in my work that I experienced racism, I experienced any kind of activism. I'll give you an example. Okay? The day 9/11 happened, I was in Chicago, I had 4 review course.
Can we just do one thing before we go on with I just want to end this thing because it's going to end. Yeah, otherwise it'll stop. Okay, give me 1 second. Inshallah, this was our NIMS talk in Islamic and academic medicine. I'd like to thank Dr. Asim Padella for being here, staying engaged with this conversation. Like you could see today, there's so much that needs to be done. One thing I took away that I want to make sure we leave with our audience is not just something to hear. There's action-oriented things. Read, and these have real ramifications for how our lives are going to end and what kind of care we get for our own people. I had a friend recently, his family member passed away in Saudi Arabia, and they were able to have someone read Quran to them for 30 minutes to 45 minutes because they have that intizam or system set up. And I just kind of got scared for myself. Na'uzubillah, astaghfirullah. Like, what if, I go on an accident, skiing accident, something happens to me somewhere, and and I don't get to hear the Quran ever again. I had anxiety. Who's going to come? Maybe my brother won't know how to read that much Quran. Maybe people don't know about me. So these have real ramifications. And if you're a doctor who thinks, that feeling we have, what can I do? We all can do stuff. I think we just have to get out of this Mere biwi, mere bache, mere gadi, whatever. My wife, my kids, that's it. Khalas, I made it. I'm going to chill. But when you die, we're all going to die. And this is a lot of this conversation, the way our healthcare is delivered. If I could hear Surah Rahman, if I could hear Surah Baqarah maybe in my last weeks, maybe if things are going on, we have that somehow in the future we come up with this reality that this is something that's spiritually beneficial, and we have to believe in the system we live in, that in America there's grants, there's universities, there's institutions, they help get these things happening. So my closing message is be involved, follow him on Facebook, Twitter, LinkedIn, whatever your stream of information is. Stay engaged if you're a Muslim in medicine or any field. We are the civilization of knowledge, alhamdulillah, and we're the ummati of Rasul sallallahu alaihi wasallam. So to struggle and to strive is who we are. Inshallah, we're going to close with a small dua. ربنا آتينا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار اللهم أنت السلام منك السلام تبارك يا ذو الجلال والإكرام إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما وسبحان ربك ذي العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين.